Hi, this is Dr. Spencer, and I've gotten quite a few questions regarding the coronavirus. And I really wanted to take this opportunity to speak about the coronavirus as it relates to patients that may have been diagnosed with cancer, specifically breast cancer, but cancer of any type. A lot of the information in the media can create a great deal of confusion and anxiety, but I really want you to be encouraged to stay calm and have clarity and know that we can get through this just like any other challenge. So, if you've been diagnosed with breast cancer either currently or in the past, you may be considered a very vulnerable population. However, rest assured that patients that that are undergoing current treatment, i.e., radiation, chemotherapy, or you have an upcoming surgery, those types of patients take priority in terms of being able to be seen by your healthcare provider. But there are certain things that you need to be aware of prior to going on your routine office visits. This may be your surveillance visit or your chemotherapy infusion or your radiation treatment. Make sure, one, if you've traveled within the last 2 weeks, that you let your healthcare provider know. More importantly, even if you hadn't traveled, but if you experienced any fevers, persistent cough, fatigue outside of the normal symptoms that you may be experiencing from therapy, to make sure you let your healthcare provider know right away, because he or she may need to make some adjustments to your treatment schedule. But again, you are the priority in terms of making sure there aren't any lapses in your treatment because of the coronavirus. There are certain precautions that do need to be kept in mind that apply to all patients, but specifically cancer patients. One, make sure that you engage in proper hand hygiene, which is 20 seconds of hand washing when you are out in public spaces, or if you've just undergone your treatment. Make sure you take your hand sanitizer with you. In addition, it's super important that you try to avoid touching your face, specifically the T-zone of the face. Viruses are unique in that they love to hang on to mucous surfaces, i.e. the eyes, nose, and mouth. So it's very vital that you try to minimize touching your face. And if you do sneeze and cough, and that's going to happen, just make sure that you do it with the inside of your elbow or with tissue to avoid spreading droplets to other people. Again, you're not spreading anything that you don't have coronavirus, but in order to just keep exposures at a minimum. In regards to wearing a mask,